let's talk COVID-19 and pregnancy. So I am also pregnant. I am 16 weeks and I am also a healthcare worker. So naturally, I'm gonna have questions about how does COVID-19 affect me and what should I be doing as a healthcare worker in order to prevent getting COVID-19. Even if you're not a healthcare worker, I mean, you're still probably wondering what are my risks. So hopefully in this video, we'll answer a couple COVID-19 questions that will answer those questions for you. So let me just start with telling you that information is very limited on COVID-19 and pregnancy, but we'll try to answer these questions as best as possible. Are pregnant women at higher risk of developing COVID-19? So pregnant women do not appear to be at higher risk for severe disease, more so than anybody else. However, I would still limit your exposure because there just hasn't been enough studies, major studies, I'm talking with hundreds, thousands of pregnant women and COVID-19 yet. I'm sure we'll get those studies after we have all the data and all the facts, after this does boil over. But right now, we don't have any major studies to tell you definitively that pregnant women aren't at risk. However, from the few women that have been pregnant and have had COVID-19 and have delivered, they have not passed it on to the baby. I will tell you that pregnant women's immune system can be decreased when you're pregnant, and just the fact that you have a belly is going to push up your lungs, and that's going to cause you to have really a shortened lung span and decreased breathing, which can make it more difficult to breathe. COVID-19 can cause respiratory distress, and if you already have a decreased lung span, it's going to be pretty hard to breathe. But according to the CDC, they do not know if pregnant women are at a greater risk. What they can say, with viruses in the same family, other coronaviruses basically, and flu-like illness viruses, we have seen an increase in severe illness in women who are pregnant. Should pregnant women wear masks more so than the general public? Well, the CDC is recommending right now not so much. They say pregnant women should follow the same recommendations as the general population. So you should wear a mask if you're experiencing symptoms, if you're having a cough or you're sneezing a lot, or if you're COVID-19 positive and you're going to be around other people, definitely wear a mask. Can COVID-19 be passed on from a pregnant woman to her fetus? Well, we still don't know. Currently, there haven't been any infants that have been born positive with COVID-19 to pregnant women who have been COVID-19 positive, but the data has still yet to prove anything yet. So currently, no infants have actually tested positive for COVID-19, even when the mom was positive for COVID-19. However, the data is still coming out, and this has only been based off of a small number of patients. So is the timing of delivery affected by COVID-19? Meaning, will you deliver earlier because you have COVID-19, or does it really matter? So the CDC says that the timing of delivery says that it should not be affected by COVID-19. Actually, women who have COVID-19 or are suspected to have COVID-19 infection in early pregnancy, let's say first or second trimester, the delivery actually doesn't change at all. There's no recommendation to change the delivery to deliver early. For suspected positive women in the third trimester, it's actually recommended to postpone delivery until you have a negative COVID-19 test or you have lifted that quarantine. So just having COVID-19 does not determine whether you should deliver early or not. It's not recommended that you deliver at 39 weeks or at 38 weeks because you were infected with COVID-19. And COVID-19 is not an indication for a C-section, just having COVID-19, the infection. Now, there are other consequences that may occur, but ideally just having the infection itself does not indicate having a C-section or delivering early. So what about breast milk? So all of you moms that want to breastfeed or already are breastfeeding, what if I get infected with COVID-19? Absolutely. It is actually recommended that you continue to breastfeed or pump milk if you are infected with COVID-19, because breast milk actually has a lot of really great immunological properties for babies. It can help them fight a lot of diseases. So they have done a few studies in coronaviruses such as SARS, similar to COVID-19, and they have found that SARS was not passed through breast milk. However, you can still pass it by respiratory droplets. So all that we're touching, hand washing, coughing, sneezing, we can still pass that on to our babies. So what they're doing now is actually quarantine mom, and she is not allowed to touch baby. So that in itself is not the best option, but you can still pump your milk and you can still give that to baby. Fortunately, right now, we just don't have enough data to really say definitively yes, no on some of these questions that we are asking. But according to the CDC and expert opinion and ACOG, which is the American College of Gynecology, these are the recommendations thus far. And I'm sure with more data that comes out, we'll find out better recommendations for pregnant women with COVID-19. So in all, it is recommended that pregnant women take the same precautions as every single other human being. It's good to practice social distancing, hand washing, hand sanitizing, and if you're coughing, to cover your cough like that. So again, this information is based off of the CDC guidelines and ACOG, American College of Gynecology, and expert opinion. So I will link those below. So please like the video if you found this helpful, and if you want to see more of these videos, definitely subscribe.